Cholecystitis is an gastrointestinal disease because this picture shows that gallbladder inflammation, CT findings, X-rays, look at this, and MRI findings, detail going on. Introduction. Cholecystitis is the inflammation of the gallbladder, typically caused by obstruction of the cystic duct, often due to gallstones, it can be an acute or chronic condition requiring timely medical intervention to prevent complications. Cholecystitis is a significant medical concern, especially in people with certain risk factors like obesity, high cholesterol, and a sedentary lifestyle. Definition. Cholecystitis is defined as inflammation of the gallbladder, often associated with the presence of gallstones blocking the cystic duct. It can occur as a sudden acute attack or as a chronic condition with repeated episodes of inflammation. Types. 1. Acute cholecystitis. This is sudden onset of gallbladder inflammation, often caused by gallstones. It presents with severe abdominal pain, fever, nausea. 2. Chronic cholecystitis. This occurs due to repeated episodes of acute inflammation, leading to a thickened, scarred gallbladder. Symptoms are often mild but occur over time. 3. Acalculous cholecystitis. Inflammation of the gallbladder without the presence of gallstones. It is less common and typically occurs in critically ill patients. 4. Emphysematous cholecystitis, a rare and severe form of cholecystitis where gas forming bacteria infect the gallbladder, leading to gas formation in the walls of the gallbladder. Causes. 1. Gallstones. The most common cause where stones block the cystic duct, leading to a bile accumulation and inflammation. 2. Infections. bacterial infections, particularly from the intestines, may cause worsen cholecystitis. 3. Acalculous cholecystitis. This is caused by conditions such as trauma, burns, or prolonged fasting where there is no gallstone involvement. For tumors, gallbladder tumors can obstruct bile drainage leading to inflammation. 5. Biliary sludge. Microscopic particles can sometimes cause duct obstruction and inflammation. Risk factors. 1. Female gender. Women are at high risk, especially during pregnancy. 2. Obesity. Excess weight increases the likelihood of gallstone formation. 3. Age. Old individuals are more prone to cholecystitis. 4. High fat, high cholesterol diet. It increases gallstone formation. 5. Sedentary lifestyle. Physical inactivity is associated with increased risk. 6. Rapid weight loss. Extreme weight loss can lead to gallstone formation. 7. Hormone therapy. Estrogen based treatments may increase the risk of gallstones. 8. Diabetes. People with diabetes are at an elevated risk for complications related to gallstones. Complications. 1. Gangrenous gallbladder. If blood supply to the gallbladder is reduced, it can lead to tissue damage. 2. Gallbladder rupture. Severe inflammation may lead to tear in the gallbladder wall. 3. Peritonitis. If the gallbladder rupture, infection can spread to the abdominal cavity. 4. Choledactylosis. Stone may migrate into the common bile duct, leading to further obstruction and complications like jaundice. 5. Biliary pancreatitis. Inflammation of the pancreas caused by gallstones. 6. Abscess formation. Pus may collect in or around the gallbladder. Pathophysiology. The primary mechanism involves the obstruction of the cystic duct leading to bile stasis. This accumulation of bile in the gallbladder causes increased pressure, reduced blood flow, and inflammation. In acute cholecystitis, bacterial infection often follows bile stasis and further exacerbating inflammation. Chronic cholecystitis occurs with repeated inflammation leading to fibrosis and thickening of gallbladder wall. Pathophysiology of cholecystitis step-by-step process. 1. Obstruction of the cystic duct. 2. Bile stasis. 3. Distension and increased pressure. 4. Muscular damage or inflammation. 5. Bacterial invasion. 6. Progression of inflammation. 7. Ischemia and tissue necrosis. 8. Perforation and rupture. 9. Abscess formation or fistula. 10. Healing or fibrosis. Cholecystitis develops due to the obstruction of bile flow, which leads to bile stasis, increased pressure and inflammation, bacterial infection and ischemia can worsen the condition, leading to potential complications like tissue damages, necrosis, perforation and peritonitis if not treated promptly. Signs and symptoms. 1. Right upper quadrant pain, typically severe and may radiate to the right shoulder or back. 2. Fever indicates infection. 3. Nausea and vomiting often accompany the pain. 4. Jaundice occurs if bile flow is obstructed. 5. Positive morphe signs, pain or palpitation in the right upper quadrant during deep breathing. 6. Abdominal tenderness, pain worsens with movement or coughing. 7. Goading, involuntary muscle contraction over the inflamed area. Diagnosis. 1. Ultrasound, the most common diagnostic tool, showing gallstones and inflammation. 2. CT scan can detect complications like perforation or abscess. 3. HYGIENE scan assess gallbladder function and cystic duct obstruction. 4. Blood test, increased white blood cell count, elevated liver enzymes, ALT and AST. Bilirubin and alkaline phosphates. 5. Endoscopic retrograde. Cholangiopancreatography, used to detect stone in the bile duct and allows to their removal. Nursing diagnosis: 1. Acute pain related to inflammation of the gallbladder. 2. Risk for infection related to inflammation and possible rupture. 3. Impaired nutrition due to nausea and vomiting. 4. Anxiety related to hospitalization and surgery. 5. Knowledge deficit regarding condition, treatment and prevention. Management: 1. NPO, nothing by mouth. The rest the gallbladder and reduce inflammation. 2. IV fluids to maintain hydration and electrolyte balance. 3. Analgesics, pain management with NSAIDs or opioids. 4. Antibiotics to treat or prevent bacterial infections. 5. Cholecystectomy, surgical removal of the gallbladder. The definitive treatment: A. Laparoscopic cholecystectomy is the preferred method due to quicker recovery. B. Open cholecystectomy may be needed for complicated cases. Treatment: 1. Antibiotics, broad spectrum antibiotics to treat infection. 2. Cholecystectomy, removal of the gallbladder is the definitive treatment, preferred either laparoscopically or through open surgery. 3. ERCP, used to remove stones from the common bile duct. 4. Percutaneous cholecystectomy, drainage of the gallbladder in critically ill patients who cannot undergo surgery immediately. 5. Pain management, NSAIDs or opioids to relieve severe pain. Psychosocial medicine: patient with chronic or recurrent cholecystitis may experience anxiety, depression or stress due to chronic pain and the impact on daily life. 2. Post-surgical concerns may include body image issues, concern over lifestyle changes after gallbladder removal. 3. Providing psychological support and counseling can help patient cope with these challenges. Prevention: 1. Healthy diet. A balanced diet low in fat and cholesterol reduces the risk of gallstones. To regular exercise, maintaining an active lifestyle, reduce obesity and associated risks. 3. Gradual weight loss. Avoid rapid weight loss, which can increase the risk of gallstone formation. 4. Avoiding prolonged fasting. Long periods without eating can contribute to gallstone formation. In conclusion, cholecystitis is a common inflammatory condition of the gallbladder, particularly caused by gallstones. Early diagnosis and treatment are essential to prevent complications such as perforation, infection, and abscess formation. Surgical intervention, particularly cholecystectomy, is the definitive treatment for most cases. Prevention through lifestyle changes and timely medical attention is crucial in managing the condition effectively and reducing the risk of recurrence. Psychosocial support also plays a vital role in helping patients adjust to life post cholecystectomy. Thank you. Have a nice day.